Around 100 million people across the country are burdened with medical debt, but hundreds of thousands of people in Illinois could see theirs eliminated.
It's part of the plan Governor Pritzker unveiled in his budget address in February. State Capitol reporter Theodora Coulivaris is live in our Capitol newsroom. Theodora, how does this work?
Well, Brandon, it's a 4-year plan with the goal of getting rid of $4 billion in medical debt for more than 1 million people in Illinois. Still, hundreds of thousands of people across the state could see some relief a lot sooner. If you've ever spent a couple of days in the hospital, you might have went home with some medications or treatments to follow to feel better.
But after the care ends for that circumstance, many walk away with unexpected pain. Not only the emotional and physical toll of the crisis that they've been through, but a serious financial toll, too.
Around 14% of the state's population has medical debt in collections.
The stress and strain of mounting medical debt on top of a healthcare challenge can significantly and adversely affect an individual's overall financial well-being, increasing their likelihood of bankruptcy and even make them reconsider seeking future medical care.
Now, the governor believes he has an answer to those expensive medical bills. For the upcoming fiscal year, the proposed budget would set aside $10 million to get rid of $1 billion in medical debt for nearly 340,000 people. It would be a part of a 4-year plan to wipe $4 billion in medical debt for more than 1 million people in the state.
Households with health insurance and even middle income struggle underneath the weight of medical debt. It is crushing, it is massive, and that is why this initiative is so significant.
That's not the only initiative that could help people. A bill that unanimously passed in the Senate would ban consumer reporting agencies from including adverse information about someone on their credit report when it comes to their medical debt.
You shouldn't have your credit score lowered because of an unexpected illness or injury. It's just not fair. And I think medical debt has shown that it's not a good indicator of one's ability to pay bills or credit worthiness.
Now, a program like the one that the governor proposed in his budget is already in place in Cook County. They've been able to get rid of $350 million in medical debt for about 200,000 people. Reporting live in Springfield, I'm Theodora Coulivaris, WCIA 3, your local news leader.
All right, Theodora, thank you.